Hello everyone, my name is Getrude Nalukwata. I am from Uganda. I am a nursing officer by profession. I work in one of the government health centers in Kampala, Uganda. I am 28 years old. I come from a family of 6 children, 5 girls and 1 boy. I am the firstborn at home. As you see me here, I am a total orphan who grew up without parents. Both my parents died when I was 6 years old. I was still very small, and my other siblings were still very small. They were very young. After the death of our parents, my elder sister became the head of the family, and she was in primary 5 by that time, around 12 years old. So she started to manage the family as the head of the home. It was not easy for us to grow up without parents. It was very sad for us. Most of the time, we could sleep hungry without food. And when we could fall sick, we never had money to take us to hospital. We suffered and we suffered. It was not easy to survive. We were neglected by people. They discriminated us because they thought we were HIV positive. They never wanted to associate with a positive child in the village. They knew it very well, we were HIV positive. But luckily enough, when we tested for HIV, we were HIV negative. Life continued to be hard. We were living in a very small house in the village where we faced a lot of problems as orphans. We missed the parental love. Sometime, God heard our prayers and brought to us a woman of virtue, Sister Resty Ndagano, who learned to know about the orphans that were taking care of themselves in the village. And she came to rescue us. She connected us to Raga Hospital orphanage program. We were taken to school where I studied after secondary education. I wanted to join the nursing school life. Because my parents died of HIV, they never had anyone to look after them. There was no medication. In the dream of my life, I said I have to become a nurse to help the people suffering from HIV. I studied, and after my secondary education, I went to a nursing training school where I studied and became a nursing officer. I am now very happy. I work in one of the government health centers in Kampala, and I earn quite some money for my life. I look after patients who are HIV positive, and because when I was growing up, I faced a lot of challenges, I felt it was very important to help someone who might be going through the same problems that I went through when I was growing up. So from the little salary that I am paid, I got some child from my health center for HIV people. I started paying for her school fees and is now happy once again. I try to console him. I tell him, don't suffer so much, don't think about death. I am your sister. So I am happy I'm looking after another orphan. I would love to thank the Action Canchanabury team for paying for my education. I am happy to let you people know that me and my siblings now, we are very happy. I am a nurse, I am working. The girl who follows me is also a nurse. She's working. And our last born sister is also working because she studied and became a makeup artist. Our firstborn sister, who looked after us when we were growing up in the village, is also happily married, and she has now 3 children. After school, she got married. I'm hoping to help so many other orphans in future because that is my heart. It is where my feeling is. I would like to help so many others to become out of that life where orphans cry without parents, where they suffer so much without food. I would love to be someone who can help them to get out of that situation. I am very happy. I am very happy on behalf of my siblings and other orphans in the village who are getting help from Action Canchanabury. We are really very grateful, though we do not have enough words to thank you, but you have really done a good job in us. We are happy once again, though we grew up from a sad life. We are now very happy, and we can say thank you so very much.